All right, looks like we have about 25 viewing right now. I know we had quite a few more than that sign up, so I'm going to give it about 30 to 40 seconds for some more folks to get in here, and then I'll go ahead and get started in just a minute. Okay, let's go ahead and get started. So we're going to talk about safety in the office today. There is going to be a brief portion about COVID-19 and the Restart Ohio initiative. For those of you that are viewing from the state of Ohio, we do have a little bit of information in here on that. So a little bit about me to start out with, those of you who haven't been to any of my webinars before. Originally, I'm from the tri-state area. I lived in Pennsylvania most of my life, worked in Ohio, Pennsylvania, and West Virginia for Careworks when I first came on to Careworks. Prior to that, I worked safety and industrial hygiene for Zachary Engineering out of Texas, safety and industrial hygiene for Marathon Petroleum in Findlay, Ohio, and then health and safety coordinator for a pipeline construction project in Southwest PA before coming here to Careworks Comp, where I'm now a safety and risk management consultant. I'm now based out of Phoenix, Arizona, and I've worked domestically and internationally over the last 4 or 5 years in 40 states and 5 countries. Primarily what I travel for is to train fall protection, confined space, rescue, body recovery. Those are my subject matter expert areas, and I do that under the brand name MSA, the safety company. They contract with us for that. And I also work in Ohio and Washington specifically for Careworks Comp's insurance clients, TPA clients. One more thing on this slide. If you want to follow me on LinkedIn, the link's right there. After this presentation, I will send out a PDF of these slides within a few hours. So, but that LinkedIn, I post updates to rules and regulations and things like that. When things change, I often share those articles via LinkedIn. All right, during the live presentation, it will be recorded and be able to be accessed in the future at this link. You can and are encouraged to ask questions as we go along using the chat box feature, which is over to the right side of the video. So if you have any questions or anything, you can pop them in that chat box. I don't watch it all the time, but when I get to certain points in the presentation, I'll take a look at anything that's in the chat box and respond to it. You can also email me after the presentation. You all should have received an email from me this morning where I sent out a little reminder. And if you're watching the replay, of course, I won't be in the chat box. So if you're watching the recorded version, make sure to email me, john.valentine@careworkscomp.com. Okay, so let's start out by talking about what can go wrong in the office. Any issues could lead to absences, sickness, conflict, and injuries could be physical, psychological, or illness and diseases. Okay. Anytime we have any of these issues, whether it be absences, sickness, or conflict within the workplace, or any of those injuries, we can see our profits go down, we see our margins decrease. We've seen a lot of that with COVID-19. We've had folks out due to sickness, we've been closed due to sicknesses, so we've seen an extreme example of that over the last couple months. And there are various types of hazards, and we're going to cover all of these during the presentations today. Our basic hazard categories are going to include physical hazards, chemical hazards, biological hazards, which is where COVID-19 is going to come into play, ergonomic hazards, psychological hazards, which are often overlooked, including morale, and workplace bullying and workplace violence, and behavioral hazards, so people performing behaviors that are unsafe. Okay, so let's start out with the chemical hazards. There are a lot of chemical hazards that are often left unchecked and unmitigated in office environments, especially in maintenance areas. So once in a while I'll be out doing a site audit for an office type client, and typically there are not many hazards to find in an office environment that would be considered OSHA violations, but where I do find them almost all the time is with GHS HAZCOM. So GHS stands for the Global Harmonized System, and HAZCOM stands for Hazard Communication. And that is an entire, essentially, chapter in the OSHA regulations. What we find chemical-wise in an office is going to be cleaning agents primarily for the maintenance group and the janitorial group, toners, developers, ink, solvents, paints, fuels, adhesives, and then also employees often bring in unapproved chemicals. It's important that any chemical that's being brought into your facility has an SDS, a safety data sheet, which we're going to talk about a little bit more in a few slides. And those safety data sheets need to be kept on file and somewhere that they are going to be accessible for employees who are using any of these chemicals. Another place I see this, I know it's not an office environment, but where I see it become really problematic is hair salons. Because oftentimes in a hair salon, individual hairstylists will bring in their own products or their own outside chemicals to treat hair, and so the employer will not have a safety data sheet for those chemicals that hairstylists are bringing in. The same thing can happen in an office environment. An employee brings in their own cleaner because they don't like the cleaners that are available by the employer. It's okay for them to do that as long as the employer then gets the SDS for that chemical and make sure it's safe for the workplace. So, one thing your employees should be able to do is identify the meaning of each of these pictograms, which again with office employees that are, and this is going to be employees who are exposed to chemicals, so primarily your janitorial and maintenance staff should be able to identify these pictograms. You should have HAZCOM and GHS training in place. Again, this is something that offices are typically lacking. It should be included in your onboarding for all employees, and you're encouraged to refresh this annually. You don't necessarily have to, but if you would have a chemical exposure of any sort and OSHA or the BWC would follow up on it and find out that none of your employees have a clue about HAZCOM or GHS, you're going to get cited for that failure to properly train them. So I recommend refreshing it annually, and it does not take long to go over HAZCOM GHS information. You should have safety data sheets for every chemical in the workplace. That is a document that you can get from the manufacturer of the product. You can also find them all online pretty quickly just by Googling them. And it includes all the hazards, how to treat someone who's been exposed to it, the different ways you could be exposed to the chemical, and how it affects you. There is a new layout for the SDS sheets that changed way back in 2012, so it's not all that new. By now, you should most certainly have all your SDSs updated to that new format. It's organized and pretty much uniform for all chemicals now. Instead of having manufacturers that could just kind of willy-nilly throw together an SDS sheet, they have to follow a certain template now. You should have an annual review of your SDS, HAZCOM, and GHS programs to ensure compliance. And you should have emergency eye wash and first aid stations available throughout your facility anywhere they would be necessary. With the emergency eye wash stations in an office environment, it's going to be pretty rare to have those in most places other than your maintenance area. If you have a maintenance or janitorial department, they should certainly have eye wash available. For janitorial services, maids cleaning, things like that, where they're going to be spraying window cleaner or something that could blow back in their eyes, I would recommend having the little portable bottles of eye wash right on their little cart that they have all their other chemicals on. Emergency showers for workplaces with more serious hazards. Again, I really doubt that that would be something necessary for an office. But if you have a maintenance group that's working with some chemicals, especially pesticides, large amounts of pesticides, you should have an emergency shower available for them. And proper chemical storage is another big part of HAZCOM and GHS. So you want to make sure you're properly storing any volatile chemicals. Any explosive or flammable chemicals should be kept in a flammables cabinet. And any reactive or self-reactive materials should be properly stored. And the proper storage information for those chemicals is again found on that SDS sheet, that safety data sheet that you should have for every chemical. And then lastly is proper use and labeling here on this slide. Unlabeled chemicals are low-hanging fruit for OSHA and the BWC to come out and cite. And then PPE as well. When you're using cleaning products, especially in the workplace, we need to make sure we're wearing the proper PPE because we're going to be held liable if any employees are exposed and get injured. One of the most common oversights I see with PPE and chemicals in office workplaces is janitorial staff not wearing safety glasses. If you're going to be spraying chemicals, whether they're aerosol chemicals or not, you should be wearing safety glasses because if that splashes back into your eyes, you're now going to have a claim on your hands. Whether it be big or small, it's still a claim, and you don't want to have that happen. So your janitorial staff or anyone using cleaning chemicals should have safety glasses on, and oftentimes some of the chemicals they're using call for gloves as well. Even if their skin's not easily irritated after years and years of using these chemicals, it can have effects on their skin. So we recommend gloves as well while using most cleaning chemicals. And again, if you refer to the SDSs, they're going to tell you which ones require that. Moving on from the chemical hazards, that was a really brief overview of HAZCOM and GHS. Any training you do for your employees, the initial training should take, I typically take from 30 minutes to an hour on HAZCOM GHS. But once you do it that one time, each year the refresher is fairly fast, like 15 to 20 minutes tops. Definitely recommend if you don't have a HAZCOM GHS program, you get that in place really soon because again, those requirements all changed back in 2012. Moving on to biological hazards, this is where we'll end up talking a little bit about COVID-19. Towards the end, we're going to talk about the requirements in the state of Ohio for responsible restart as well. But basic infection prevention measures, you should promote frequent and thorough hand washing. You should encourage workers to stay home if they're sick. Even before this pandemic, that should have been a policy that was in place. I feel that that's something that the United States as a whole has not taken very seriously, especially outside of the food industry. We've had a bad habit of encouraging people to work while sick. I do recommend people come back to work as soon as they can after an injury or sickness, but only when it's safe to do so. We don't want you coming to work and getting other employees sick, especially now that this has reached a pandemic level. There have been guidances put out to determine whether or not the exposure is work-related, and now if someone, if it can be shown that they contracted the virus at work, it's now going to be a claim that the employer is going to end up paying for out of their workers' comp. So we want to encourage those workers to stay home if they are sick, both actively with policies such as paid sick leave when that's appropriate. We can also use teledoc services to assist in determining whether a worker should go home. Those are often quite affordable programs, those teledoc programs, for employers to have as part of their benefit process, and it's a lot cheaper, especially for the worker, to get a hold of a teledoc service than it is to schedule an actual appointment, go to a doctor. If they can get diagnosed via a web conference or a phone call and find out whether or not it's safe for them to go to work, it's going to be a lot more manageable. We want to discourage workers from using other workers' phones, desks, tablets, tools, and equipment when possible. Obviously, there are some things, especially expensive equipment, that's going to have to be shared. Right now, since we're in essentially a pandemic phase, we're going to want to make sure we're disinfecting that type of stuff between uses, or taking the appropriate precautions to ensure that our workers aren't getting each other sick right now. Make sure we maintain regular housekeeping practices, including routine disinfecting of surfaces, equipment, and other elements of the work environment. And when an emergent infectious disease is identified, essentially what happened with COVID-19 way back in February or March, We need to develop an infectious disease prepared response plan that is specific to that emergent infectious disease. So once that's identified, we're going to refer to the CDC and OSHA for more information on responding to that threat, as well as your state resources, the BWC, the Ohio Department of Health, those types of resources, and we are going to continually update our response plan as the information changes. And now's a perfect time to talk about this because we've just gone through it with COVID-19, so we understand what that means for our understanding to change and rules to change as we gain more understanding of a virus or an emergent pathogen. That being said, I have put together quite a few of these types of plans, both generic and specific for COVID-19. So if you're looking for something as far as a blanket plan to make sure you have a policy in place for being able to go through this process in the future, should this happen again, you can always reach out to me by email. We have a consulting group which I'm a part of, that part of our job is if you need a policy written, you get a hold of us. We'll scope it out and let you know approximately what it'll cost for us to write these policies for you, review your policies. We can also come out and do on-site audits and things like that. So we are a consulting group. So if you ever need safety and health consulting, feel free to shoot me an email and we can get that running through our department there in Ohio. Examples of some of these emergent disease information pages are right here, right on the CDC's website for COVID-19. So at this point, I think most of us have become familiar with these. And you can see that there are some things that are specific to certain industries. They have deciding when to open, ongoing mitigation strategies, and it's important to come back to these types of resources on a regular basis because the information does change as scientists get a better understanding of the virus and as we come up with better control measures. Give me 1 sec to reorganize my second desktop screen so I can see my notes. There we go. All right. So there's another link right there, which I'm not going to open this one right now, but whenever I send out the PDF, these links will be available for you. Actually, I will open that one. You may get a little warning that pops up. That's okay. I promise I didn't put any malicious files in here. It's just because it's a PDF form from OSHA, so it's letting you know it's downloading something. And OSHA has a nice, quite thick document out on preparing your workplace for COVID-19. So lots of resources out there. As far as COVID-19 specific guidelines for the state of Ohio, general office environments, which this webinar is about office safety, so I'll stick to these. General office environments do have their own specific regulations. The following are those mandatory guidelines, and this is as of yesterday. I reviewed these. Again, these could change, so here's a little disclaimer from our legal department. I'm not a lawyer. This information is not legal advice. It's just information that's there for educational purposes. Before you make any actual decisions, you should seek your own legal advice from counsel in your jurisdiction. That being said, this is essentially a verbatim copy and paste from the state's Responsible Restart website for general office environments. For employees and guests, it is mandatory to ensure a minimum of 6 feet between people. If that's not possible, you should install barriers. Places that barriers would be appropriate in an office environment would be somewhere like your front desk, where people are going to be coming in and out and talking with your employees all day. The person behind the barrier is then going to be protected from any aerosol particles coming out of the guest's mouth, nose, and face area, which are notorious for transmitting the novel coronavirus. Face coverings are required for all employees in Ohio unless it's not advisable by a healthcare professional. That's about the only really out that we have here. They do mention 2 more. If it's against documented industry best practices, which I haven't really found anywhere that is the case, or if it's not permitted by federal or state laws and regulations, which again, there's no real federal or state law or regulation that's going to give an out right there. But if someone does have breathing problems, underlying conditions that makes it dangerous for them to wear a face covering, that is about the only way, in which case they will need written documentation from a healthcare professional. And the reason they need that written documentation is because you have to be able to, as an employer, prove that to local health officials if they would come out and question why certain people are not wearing masks. A face covering, however, is not required if the employee is working alone in an enclosed office space. So if you have cubicles that are taller than the employees while they're sitting down at their desk, then that would be considered a barrier in an enclosed office space, so they would not need to wear a mask as long as there's nobody else within that cubicle with them. But if they were to exit their cubicle and start to walk around the office, they would need to put their mask back on. It's the same idea for us going to the store. We should be wearing a mask when we walk into the store, when we're in close proximity within 6 feet of other people. But once we exit that store and start walking back to our vehicle, there's nobody around us, it's okay to take off the mask then, to get in your vehicle and drive without the mask on. The whole purpose of the mask is to protect other people from you and yourself from those other folks who we don't know if they've been exposed or if they may be carrying the virus. Personnel should work from home whenever possible and feasible with business operations as well. So even though offices are allowed to open back up, if you can continue telework efficiently, the state is encouraging you to continue to do so. And employees must perform a daily symptom assessment. Let me bring up my whole slide. The daily symptom assessment should include taking your temperature with a thermometer and monitoring for fever, though I recommend just having a no-touch thermometer and checking people as they come in the door. And if they have a fever, we're going to send them home. We're going to send them to the doctor unless they already went to the doctor and the doctor said, your fever is due to something else. It's not the coronavirus, it's not something contagious, in which case, with that doctor's note, we then can allow them to come in. We should require employees to stay home if they're symptomatic at all, including coughing, trouble breathing, a newly developed loss of taste or smell is another symptom that some folks didn't know about until recently. We need to require regular hand washing, reduce our sharing of work materials, limit travel as much as possible. As far as that's concerned, that means like traveling out to client sites, and stagger the arrival of all employees and guests. So this is when you get to kind of like the late stage of your game plan with COVID-19, is trying to arrange it. If you have 500 people coming into your office, we want to try to limit that into waves so we don't have 500 people all bumping into each other all at once. So if you can stagger your start and end times for work, have some people come at 6, 7, or 8, and then leave at 3, 4, or 5. So kind of breaking it into sections. Manufacturing plants are really good at that because they're used to doing it, but office buildings aren't necessarily used to staggering start times. So that's something to think about as well. Also, if you can have an independent entry and exit, that's not listed here as a requirement, but it's a best practice. If we have folks that are going in and out the same door, they're going to be coming in close proximity to each other and facing each other, which puts them at higher risk. But if you're coming in one door and going out another, the people exiting aren't going to be bumping into the people that are entering. Some recommended best practices: ensure seating distance of 6 feet or more. If you're in a common area or an area that you're going to have multiple employees that are seated near each other. Face coverings are recommended for all customers and guests. They are not required. However, there is a rule that says you are not allowed to stop someone from coming into your building that has a face mask on. So like if you're an office building, you're probably not going to have many guests, but say you're a grocery store. If a customer of the grocery store wants to wear a mask, the grocery store is not allowed to tell them, no, there are no masks allowed in our store. They have made that illegal. But the guests do have a choice of yes or no whether they're going to wear one. Enable natural workplace ventilation. Health questionnaires for symptoms at entry, which isn't required, but again, it's a best practice. Temperature taking protocol for guests. So in an office environment, you probably don't have many guests coming in. It's worth screening them for symptoms and denying them entry for that day if they are showing symptoms. However, in a grocery store environment, you can't necessarily screen every single customer that's coming in, and also you can't really deny them access to groceries. So it's a more complicated issue for those retail environments. But in an office building, it's a lot easier to just say, hey, you have a fever today. It's probably best we reschedule this meeting with this person who is coming into your office building, or take it to a phone conference or a web conference instead. As far as your physical spaces and your workstations, mandatory rules for those in your office environments include frequent disinfection of desks, workstations, and high contact surfaces. So if you contract with a cleaning service or you have your own in-building cleaners, we're going to be jacking up the amount of cleaning that they are doing. That's going to increase. Daily disinfection of your common areas is required. Canceling or postponing in-person events when social distancing guidelines can't be met. Again, with the social distancing guidelines, it's a 6-foot rule, or everyone can wear a mask if you're going to be in closer proximity. That's going to replace the social distancing with PPE. Again, the social distancing with the mask is better, though. No buffets in cafeterias, so if you have a cafeteria in your building, they're not permitted to utilize a buffet style right now, but they can still serve food. Utilize disposable tableware and other materials instead of stuff that needs washed, because then your dishwashers are going to be coming in contact with it. And establish a maximum capacity for your building, for example, 50% of the fire code. It doesn't say it has to be 50% of the fire code, but essentially what the state wants you to do is say this is the most amount of people we're going to let in our building. We do recommend it be lower than normal, but you should technically base it off of allowing that social distancing. Recommended best practices: you could redesign your spaces and workstations to be 6 foot or more apart if you don't have independent office spaces. Close cafeteria and gathering spaces if possible. Or conduct regular cleanings. Limit congregation in office spaces. If it's not necessary to get together in a group, don't. Redesign your spaces and workstations for 6 feet or more of distance. Sorry, I put that on there twice. Divide essential staff into groups and establish a rotating shift. And you should try to maintain an availability of at least 3 weeks of cleaning supplies. This is important. We saw at the beginning of COVID-19, our supply chain started to get extremely disrupted. That could happen again. It's still ongoing for certain things. There are some factories in the U.S. that are still shut down because their workers are continually getting sick. That's become a problem. So keeping a stock of your essential supplies, including cleaning supplies, is important. That way, if you do have trouble getting some, you at least have a little to hold you over. And if you have a confirmed case of coronavirus in your workplace, you want to immediately isolate that person, and they should seek medical care for any individual who develops symptoms while at work. Contact the local health district about any suspected cases or exposures you have, because they will come and assist in the contact tracing. Shut down the shop floor, or in this case the office floor, for deep sanitation if possible for where that person was working. So if it was someone on the 3rd floor that got sick, that 3rd floor we're going to have emptied out, and we're going to have deep cleaned according to CDC guidelines. Recommended best practices: work with local health department to identify potentially infected or exposed individuals to help facilitate that effective contact tracing and the notifications of folks who may have been exposed. And testing is now readily available, so you should test all the folks who may have been exposed should then be tested. Following that testing, contact the local health department to initiate proper care and tracing. All right, that is it for the requirements for COVID-19 in the state of Ohio that are specific to office buildings. Okay, we're going to jump over to ergonomics now. Employee workstations they should be designed to reduce excessive bending and stretching, so you don't want to have materials. For example, I'm a bad example of this right now in my home office. I have my little cup of pens to where I actually have to lean forward and reach the whole way to the corner of my desk to grab those. If I would be doing that on a regular basis, I could end up with a strain or exertion injury from bending and reaching. We want to minimize that bending and reaching, or bending and stretching. The desk area and the chairs should be fully adjustable. Oftentimes the desks are not, but the chairs should always be fully adjustable. Not only that, but we should train our employees on how to properly adjust their office spaces, and there are a lot of online tools to do that. If you just Google office ergonomic tools, you will find computer workstation programs where you actually open up the app that they have on their website, and it will walk you through adjusting your chair so that it's at a proper height, so that you have the proper setup for your mouse pad, and your keyboard to reduce the instances of carpal tunnel and things like that that could lead to ergonomic injuries, which are often expensive. As silly and little as this stuff sounds, the positioning of your mouse and your keyboard could be the difference in whether or not you end up with a $30,000 to $40,000 workers' comp claim due to a surgery for repetitive motion or strains or carpal tunnel syndrome. Good housekeeping to reduce trips and getting caught up. That's something that's really easy to get under control. I oftentimes see extension cords and Ethernet cables that are run kind of haphazardly across floors that become a tripping hazard. And I had a claim last year in the state of Washington where an office worker had cables under her desk. She was wearing heels, and they got caught up in one of those cables when she was standing up to walk away from her desk, and that caused her to trip and fall, and that turned into a pretty serious claim when she fell. Never leave desks, never store items on top of shelves and cabinets, because they could then fall off, or also you're going to be on your tippy toes reaching up to get a hold of them, which could put you off balance and cause you to fall as well. We also want to make sure that we never leave desks or filing cabinet drawers open. Those become tripping hazards as well as struck by hazards. And sit and stand desks are preferred to get workers on their feet as opposed to sedentary positions for extended periods of time. But those are, that last one there, that's a pretty big investment. So it's not something you want to just go out and do willy-nilly. That's something you want to put in a CapEx budget to do over a longer period of time. As far as the chair goes, again, adjustable chairs are recommended. Good chairs are going to have an adjustable lower back support. The height should be adjustable to the point where you can get your knees and hips level. Okay. If you're sitting down too deep, your knees are going to be up higher than your hips. And if your hips are up higher than your knees, that's also not good. You want them to be pretty much level with each other, which puts your feet almost flat on the floor. Chairs on casters, which wheels, should have 5 legs. Okay, that's important because some of the older chairs that were on wheels that would only have 3 legs, they're really, really easy to tip over. If your desk is too high, you can compensate by raising the chair seat height, but you want to keep your feet flat on the floor. Never stand on an office chair to reach anything, especially if the chair has wheels or swivels. That is something that growing up as a kid I was notorious for, just climbing on anything to get something down. We don't want to do that. Don't climb on chairs. Get a step ladder or a step stool. Get the appropriate tool. As far as the computer goes, badly positioned computer not only makes the user unproductive, but it also causes discomfort. If the monitor is badly positioned, you could suffer eye strain, headaches, stiff neck, shoulders, and backache. I actually, working from home since COVID-19 started, I've been working at a desk a lot more than I'm used to. I'm used to being on the road, working on client sites, standing, walking around most of the day. I noticed that I have been leaning forward a lot into my computer because I didn't have my monitors properly adjusted, which not only led to back and neck pain, but also eye strain. The screen should be 45 to 60 centimeters away from the user's eyes. And you should adjust your computer and seating position for comfort. There are online tools, again I mentioned this before, to assist with proper arrangements. Also, another thing with the computer that I didn't mention, you want to have it angled so that you don't have light coming in from a window hitting the screen. You also don't want the light directly behind the screen either. The top of the monitor should be at eye level, Whoops. And the keyboard should be directly in front of the user. The user's elbows should bend at a 90-degree angle, and the keyboard should be angled to allow the user's wrists to be in a neutral position. And the keyboard, the monitor should be positioned at right angles to the window to avoid glare. So that's what I was mentioning before. If you have it not at a right angle, you're either going to have the sun coming in behind the screen, which makes it hard to focus on the screen, and you have to make the screen brightness different. And then also, if you have it behind you hitting the screen, you get a glare off that screen. So we want to avoid that. As far as office lighting and illumination, this is all still part of ergonomics. We want to adjust lighting to prevent eye strain as well. We want to eliminate glare and reflection. You do not also want a desk that's going to be extremely reflective, because again, that leads to eye strain. Your employees should be seeing physicians for routine eye and vision examinations, especially if they're working on a computer all day. If they need glasses and they're not wearing them, and they're looking at a screen all day that they should be wearing glasses to look at, their vision is only going to get worse because of that. It's important to take like 5-minute breaks from computer work at least once an hour, look away from your monitor, and focus the eyes on both near and far objects. That way you get your eyes back to focusing on other things at different distances. All right, that's it for ergonomic safety in the office environment. Now we're going to move into electrical safety. So cords and devices. So be aware of electrical hazards. Obviously, the injuries there are going to be shock and burns due to electric exposure. Also, it could cause a fire, building fire. All electrical problems and concerns should be reported to supervisors, and then ultimately to either a building manager or maintenance, whoever would be responsible for seeing corrective actions issued and getting that kind of stuff fixed. And electrical safety issues should take priority over most other issues in the workplace. If your maintenance crew is not qualified to handle electrical issues, they should outsource that work to a qualified electrician. This is something you should have a policy on. I see way too many maintenance workers who are making repairs to electrical systems that they have no business making, that oftentimes end up violating local fire safety and electrical codes, and ultimately can lead to fires or injuries later when someone else ends up getting in there. Electrical cords, cables, and multi-plug power strips are an issue. I see a lot of daisy chaining in office environments. You should not have one power strip plugged into another. You should not have an extension cord plugged into a power strip. Those things are designed, power strips, surge protectors, that type of stuff is designed to be plugged into the wall and the wall only, and not to be daisy chained, because then you're going to end up overloading those. Daisy chaining is when you put multiple power strips together or multiple extension cords together. Also, extension cords are not allowed to be used permanently. An extension cord is meant for temporary use only. So if I go into a workplace and I see an extension cord running to a cooler or something that they have plugged in at all times, I'm going to write that up on an audit report and let them know, hey, if the state came out or OSHA came out, this would be a violation you could and likely would get fined for. So if you have something connected to an extension cord that's plugged in all the time, you need to have permanent electrical run to that that's designed to be used at all times. Loose cords and cables can cause tripping hazards, electrical injuries, so make sure you don't have loose cords and cables laying around. Always control your cables and cords. People can trip on protruding cables and pull expensive and heavy items that are on tables down onto their feet and legs if they get tangled up in those cords. The National Safety Council reports more than 4,000 injuries like that a year, where someone gets tripped up in a cord and it pulls a heavy object down onto them. Never use excessive cords or devices in your office. Never overload the electrical circuits. Don't piggyback or daisy chain multi-plug power strips. Already mentioned that a few times. No unauthorized person should tamper with any electrical devices. with any electrical appliance, circuit breaker, panel, or distribution board. That should only be for folks who are trained to do so and know how to handle that type of equipment, which is typically limited to your maintenance department for most things. And then when it comes to things that are higher energy or powered or need to be worked on when they're hot, that's going to be left to a qualified electrician. Do not overload your electrical outlets. If you need additional outlets, submit a work request to maintenance or building management to get outlets installed. Only a licensed electrician should modify those electrical systems, as I mentioned before. If an electrical cable, cord, or outlet becomes warm to the touch, it must be disconnected and reported without delay. This is something that you may have experienced with cell phone chargers. If you buy off-brand cell phone chargers, typically you find these types of things at a gas station or even through Amazon. When you end up getting knockoffs as far as chargers and charging cables go, not only do they damage the devices you plug into them, they can ruin those batteries. They also can overheat quite easily. They can catch on fire, all kinds of issues there. Cables and extension cords should not be run unprotected beneath carpeting because they could get damaged that way, nor should they span walkways without being secured in an approved encapsulation device or cover. So there are covers that are made to go over extension cords that are run across the floor if you need to have one run across the floor for a period of time. Don't use tape joints or splices to connect cables. Insufficient insulation or protection from liquids if you're just taping those joints or splices. Do carry out visual inspections of plugs and leads and have them repaired as necessary. Do look out for physical damage to cables, cords, plugs, outlets, etc. Do look out for insecure connections into the plug, and do switch off all electrical equipment before unplugging and before cleaning. You don't want to be cleaning a device that's plugged in and get some water. Your hands are going to be wet. If you're cleaning it and then you touch something, you just created quite the circuit and are going to get electrocuted. So make sure you switch off electrical equipment before cleaning it and unplug it. As far as office equipment goes, there are many lingering physical and ergonomic hazards with your equipment within the office. Your printers, your Xerox machines, coffee makers, all that kind of stuff. Cords, cables, and electrical hazards we already talked about. With your photocopiers and printers, some of the older ones are quite noisy. Again, most things in the office environment, though, don't get above any level that would require hearing protection, so not much worry about the noise there unless you have one big room full of printers. Inks, toners can be toxic. Ozone is obviously an issue, but typically that's in very low amounts coming out of Xerox machines and things like that. So make sure you follow your manufacturer's guidelines for those. And then obviously lasers and laser printers, but we shouldn't be tearing those apart and staring at the laser. Typically those are built pretty safe. As far as your computers and screens, we already talked about the eye strain, posture, ergonomics, and repetitive motion, so that's a little bit of review there. With drawers, we have pinch points as well as struck by issues if they're left open. And then carts, push and pull ergonomics, struck bys, and overexertions. We always want to push a cart. We don't want to pull a cart. Pulling leaves you at more risk of injury than pushing does. Also, we don't want to overload carts that we're pushing to the point where we're going to be overexerting ourselves. And then with boxes and shelves, we don't want to have any excessive lifting, reaching, or bending. We want to learn how to operate our office machines safely before we use them. We want to use caution to keep loose clothing, jewelry, and long hair out of machines. We want to keep our hands and fingers clear of the shredder, the inlet. We want to switch machines off and unplug them before we try to clear any blockage. And we should use tools, not our fingers, to clear any blockages that we have in our paper shredders or our printers, because if we're using our fingers, they could get nipped in there. So we want to use tools to clear those blockages. We want to make sure we look after our hands anytime we stick them in the drawers and cabinets. We don't want to get caught in a pinch point when we handle papers, staplers, and other devices. We don't want to get hit by those either. Keep sharp objects in safe containers or guard blades and points. So if we have X-Acto knives and things like that, we should be putting a guard back on them when we're done with them, or keeping them in a safe container where they're not going to accidentally poke someone. If we just have them laying in a drawer and we reach in, we're going to get cut eventually. Slips, trips, and falls. So you may have been in my slip, trip, and fall webinar. I think that was last month or the month before I did one on slips, trips, and falls. It may have been a while. But we want to use housekeeping as a method of prevention there. We want to prevent them by always remembering the following. Don't allow cords and cables to create a tripping hazard. Clean up all of our spills quickly. Don't block passageways and walkways. Keep office areas clean, neat, and organized. Keep stacking and storage areas safe. And report all hazards and concerns. And if you have a floor, we want to make sure it's not a slippery floor. Tile floors and things like that run more risk, linoleum floors, of being slippery if they get wet than obviously carpet would. Hazard awareness is also a method of prevention for slips, trips, and falls. Watch where you walk and be alert for things like worn or loose carpets, broken stair tread edges, uneven or broken walking surfaces, chipped floorboards and tiles. We want to pick up objects that fall like pencils, etc., and use caution if we're wearing high heels. Really, most workplaces, heels aren't necessary, so I recommend you don't even allow them, but that's up to you. As far as stairs go, avoid being distracted on stairs. Take one step at a time, and don't load your arms so full of items you can't see. Also, if you're on stairs, you should not be carrying anything with both hands. Anything you're carrying should be able to be held in one hand so that your right hand is able to be put on the banister. So keep one hand on the handrail, and don't congregate on stairs or landings. Use the elevator anytime you're transporting something heavy or something that requires two hands. And never use stairs or stairwells for storage. Keep those stairwells well lit. The reason you don't want stairwells being used for storage is, number one, it's a tripping hazard. Number two, it takes up quite a bit of space and limits the amount of space you have to walk. And number three, if there is ever a fire, that is going to be a huge issue if your stairwell is blocked or if your stairwell is obstructed. Back safety and safe lifting. We've also had an entire webinar just on this, so this is just a brief overview. We want to avoid the need for hazardous manual handling. We want to assess the risk of injury from any hazardous manual handling, reduce that risk of injury, and if you still have to manually handle objects, employees should inform the employer of any hazardous activities. We should train our employees to properly lift things and follow appropriate safe systems of work, and make sure that we use any lifting or transport equipment that's available to us, whether that be a pallet jack, a forklift, a cart, anything like that, a dolly. Those things should be used for things that are too heavy to lift ourselves. Proper lifting technique, we want to size up the load, use a mechanical aid if possible, like I just mentioned, and get help if we need it. We don't want to lift things by ourselves. If we have a bad back or something like that, we may want to ask someone else to do it completely. Check for splinters, nails, or exposed staples on the object that we're picking up, and make sure that we have a clear path before we lift it up. Once we lift it, we bring it to as close to ourselves as we can. We want to squat down, bending only at the knees and hips if the object's at floor level. So not what the guy in this picture is doing. He's bending at the waist. We want to squat down instead. And we want to lift with our legs, not our backs. So you see him bending forward. When he tries to lift that up, he's going to try to stand his back up. That's not the way to do it. We want to just stand up with our legs. Keep your head up and your back straight. It's going to look more like this here. Proper lifting techniques. You do want to lift as a team when you can. Use your legs to lift. Turn with your legs as well. And use equipment when equipment's available and when it's too heavy to lift by ourselves manually. Do not lift bulky loads alone. Do not twist while lifting. Do not use your back to lift. And don't lift heavy objects. If it's a heavy object, we want to lift as a team or use equipment. And also don't reach when you're going to lift. So if you have something that's on a shelf, before you lift it, pull it to the edge of the shelf as close to you as you can. I got about 12 minutes left here and about 12 slides, so I think we're going to do all right on time. I added those COVID-19 slides in, so they threw off my timing just a little bit today. Proper lifting technique. So I split that up, so let me go back real quick. These were the first two steps. Once we lift it up, these are the do's and don'ts of while we lift, and now we're going to finish the last steps as far as transporting it and setting it down. So we're going to move that object, we're going to keep it close to our body, we're going to look straight ahead where we're going, we're going to keep our chest out and our shoulders back, and then we're going to shift our feet to turn, not twist our body, and when we get to our destination, we're going to get set, and then we're going to lower it down. When setting it down, again, we only let our leg muscles carry it. We bend only at the knees and hips, not our back, so it's just the opposite of how we picked it up. Make sure your fingers and toes are clear before setting down the object. Move them up to the side of the object so that you don't get any fingers smashed. As far as carts go, I mentioned this earlier, do we want to push or do we want to pull? Whenever possible, you want to push a cart instead of pulling it, because when you pull the cart, they're more likely to run over their feet, and if you're pulling and walking backwards, you're more likely to slip and trip or fall. If you're pulling while walking forward, your arm is stretched out behind you, increasing the risk of back and shoulder injuries due to overexertion or bodily reaction. Unlikely to get hurt doing that the first time, but if you're pulling these carts on a regular basis, you're doing that every day, day after day after day, that injury is going to build up and it's going to be significant. As far as the operators of carts go, they should be trained on appropriate body positioning for the type of cart being handled, should be trained on how to maneuver heavy loads and avoid heavy loading when possible. In your environments, the folks you're going to train to do this are pretty much just going to be your janitorial staff who are using carts at all times, if they are. As far as someone who's just putting a couple items on a cart to move around, once a month, they're not necessarily going to need training on how to properly use a cart. It's pretty self-explanatory. The big thing is that they need to know is push, don't pull. That's the biggest thing to teach everybody. And they should walk at appropriate speeds, typical walking pace. As far as first aid goes, that shouldn't say stairs there. That's my mistake when I was putting this slide together. If your office has a first aid kit, make sure you know where the kit is, and all your employees should know where the first aid kits are. The kit should be well stocked as well. Consider taking a first aid course and having some employees also trained, particularly supervisors are good to have trained. Anyone who you do get first aid trained, you should hang their names up beside your first aid kit so that if someone does get injured and can't treat themselves or needs something beyond what they can do to themselves, they know who they can call in the office because their names and contact information will be posted by the first aid kit. Summon emergency services through the appropriate routes. Typically that's going to be 911. Train employees to do that as well. General responsibilities for employee responsibilities: cooperate with safety, security, and emergency personnel, obey environmental health, safety, and security rules, complete the required training for their job, report any and all injuries, accidents, incidents, and near misses as soon as possible to a supervisor. If we're not reporting those near misses, then we're not going to catch them before someone ends up getting hurt. Okay, make sure we report known or suspect hazards and risks as soon as possible as well, and do not expose yourself or others to unnecessary risk. Some more employee responsibilities in an office environment. General responsibilities as far as hygiene go: they should practice good personal hygiene to reduce their risk of disease and illness. That's especially important now with COVID-19 going on. Wash their hands frequently with soap and water. Keep your office and work areas clean. Leave them in the same condition you expect to find them. And report any cleaning needs to custodial services if something out of the ordinary is needed or if there was a mess made that's not typically there. Keep restrooms and break areas clean as well. And again, report all cleaning and maintenance needs as soon as possible. This is going to get us into one of the heavier topics for office environments. I believe this is kind of the last big section I have, is workplace violence. There is no perfect solution for workplace violence. Every situation is often unique. But there are some general criteria we can follow, and bear with me, this is going to be a lot of text on each of these slides. This is not something that's really easy to get across in just one slide. If you're dealing with an agitated individual that's presenting little threat of immediate harm, whether that's an employee or a customer, and they're agitated, steps should be taken to diffuse the situation. If possible, avoid accusations, avoid finger pointing, avoid making you statements, and avoid telling the individual to calm down. Instead, you should consider the following. And this is, workplace violence training is something that every employee really should have. There's not necessarily a requirement for it, but it could make or break a difference in a situation. You want to have everyone remain calm that's involved. The individual having the outburst should not be able to assert control over the situation. Therefore, the employee should do his or her best to remain calm and think through the situation. Follow applicable procedures as planned as best as possible. This is going to allow an individual confronted by an angry person to more effectively concentrate on dealing with the situation at hand. That's why it's important to have a workplace violence policy and to train everybody on it. Realize that angry individuals are often not thinking in a rational way. You want to position yourself, if you're the person mediating this or you're involved at all, you want to position yourself between that person who's angry and an exit. That way you have a way out. Listen carefully to the angry individual. Oftentimes all the person really wants is someone to just listen to them and validate them. Additionally, if someone listens carefully, he or she's more likely to understand what the person's actually looking for, and once you find what they're looking for, what they want to hear, it makes it easier to diffuse that situation. Mirror back to the individual his or her concerns. That makes it clear that the employee or you or whoever's involved is listening to this angry person. That's often all they want, is to be listened to. Don't ignore body language. Sit in a comfortable posture if possible apart from the individual. That action will assist in de-escalating. If you are in an uncomfortable position or you look uncomfortable, it's going to escalate the situation oftentimes. The more relaxed you can look and the more comfortable you can look, oftentimes that helps in de-escalation. Time's on your side. The longer you can keep the angry person from achieving his or her purpose, the more likely it is that their emotions will wane. Oftentimes after people have these outbursts, they feel really stupid about it, they regret it. It's a heat of the moment type thing, so if we can get through that moment and get to the other side of that moment, that's going to be a successful de-escalation. And you want to cooperate. If you give some cooperation with that angry person, that's going to show that person that any problem can be worked out if they cooperate with one another. Show them that it's possible to work with others to resolve problems, and explain that very few mistakes are beyond correction if they've done something inappropriate. Some more general criteria. There used to be something called the yes but technique. That has been changed to the yes and technique. So if someone is having an angry outburst, you agree with them by saying yes and. That allows the employee to agree with them and attempt to persuade them at the same time to help de-escalate. It's much easier to convince an individual to try another option this way than simply stating that they're wrong. If you keep telling them that they're wrong about being angry, they're just going to get angrier. They might actually be wrong, and you might think they're wrong, but we're not going to tell them that. Okay, if the individual does become more agitated anyway, this is where you start to try to get more people in the environment involved at de-escalating this. The employee should attempt to call for assistance and calmly explain to the agitated individual that they're going to get assistance from someone who can help them. You can say, hey, listen, I'm not able to help you with this. Let me get somebody who can. That doesn't necessarily mean you're going to go get a manager. It could mean you realize this situation could get really violent really fast, and the person you're getting to help is you're going to call 911. That it could be that, or it could just be that, okay, maybe you just need to get a manager. It's going to depend on that situation. The affected employee should attempt to isolate the threatening individual to the greatest extent possible. If we can get them to a conference room or to somewhere we can get them away from the rest of the workers, that is best. They may be led to a conference room where they can observe him or her, where the employee may be able to remove him or herself from the situation or the building. If they're angry at one person, if we can distract that person and get the person they're angry at out of there, that can help to de-escalate the situation. Keep yourself at a safe distance at arm's length. Position yourself near a door if evacuation is needed. We mentioned that already. Some more general criteria. Again, I'm going to send a PDF of these slides out. I know this is a lot of information. If the individual is violent, so this is situation number one is someone that isn't a violent threat. Situation number two, this is if someone is violent or poses a threat and evacuation is possible. If the situation can't be diffused and it's clear the individual is dangerous or has any type of weapon, you should take immediate action to obtain assistance. In this case, we're not going to work on the de-escalation right away. If possible, get up and remove yourself, create an obstacle between you and the person, knock over chairs, go through doors, lock doors behind you, and indicate the need to call 911 or text 911 for immediate evacuation. Before you encourage people to text 911, make sure that that is a feature in your area. Most cities have that now, but most rural areas do not yet have texting for 911. Designate a code word to be used to alert other employees. I have a funeral home that is a client up in Washington State, and they use the code red urn. So if an employee would say, hey, Jim, get me the red urn, that means we have a violent individual or a workplace violence situation in another room. That is going to signal to Jim he needs to evacuate the general public out of the building, evacuate the other employees out of the building, and call 911. They have a couple different code words for how serious the situation is, because surprisingly, funeral homes are actually a hub for workplace violence. A lot of high emotions there. I do have about 4 slides left. I know I just hit that 1 hour mark. If the individual has an alarm or panic button, we can use that, but most workplaces don't have something like that. The contacted individual should immediately call or text 911. So if you put that code word out there for workplace violence, whoever hears that code word knows that they should call 911 right away. If the building is evacuated, care should be taken to not induce the violent individual into noticing the evacuation. So we don't want to send an announcement out in anything other than a code word. We don't want to go and pull the fire alarm. That could trigger this individual, and if they have a weapon, that's a bad thing. So we want it to be as discreet as possible. We want to evacuate as many people without them noticing first. At least 2 individuals in the building should have a map of the building so it can be provided to law enforcement. The reason we want 2 people to have a map of the building to provide to law enforcement is because if one of those individuals is stuck in this situation with the offender, we want to make sure that there is someone else that can get a map of that building to law enforcement, because if this is an active shooter situation, they are going to need to know the layout of that building. Okay, employees should be immediately accounted for. Once you get outside, you should have a method in place to do that, whether that supervisors have a list of their employees in these situations or not. A mobile phone should be used immediately to call or text 911 and appraise law enforcement of the status of any non-evacuated employees. Okay. I apologize, my headset battery died. I'm back here now though. Situation number 3. The individual is violent and evacuation is not possible. So if you have a violent offender and you're unable to evacuate, the employee again needs to use that code word indicating the need to call or text 911 and for immediate removal of employees to a safe room. If the individual has an alarm or panic button, use it right away. The individual contacted again should immediately call or text 911. And at this point, if evacuation is not possible, secure yourself in a locked area. So if there's an offender somewhere in the workplace and you're in a different room, lock yourself in that room, barricade the door. Pretty much everything you see on TV when they're practicing for school shooters and things like that, that's what we're going to follow. Windows should not allow the assailant to see into the room as well. So if you have to block windows, do that. A mobile telephone, again, should be used to call or text 911 and provide law enforcement the status information. Any employees in unlocked areas should be identified for law enforcement. Use of the code word, again, should be done discreetly so as not to alarm or agitate the individual. Unless other employees are at risk and need to be alerted, in this instance, it may be necessary to shout the code word loudly and repeatedly. So if you can notify people discreetly, that's better. But if you can't, in this case where evacuation is not possible, you just notify. Alright, so that is it for workplace violence. I got 2 slides here on home office, and then we're out of here for today. So I added this in. This presentation was originally made before COVID-19 started. Now that COVID-19 is here, we have a lot of people teleworking, so I wanted to provide this information as well. Provide guidance on what is a safe home office environment, including what a good workstation setup looks like and how to keep physically active. This is information you can give to your employees who are teleworking. Require workers to familiarize themselves and comply with good ergonomic practices, for example, by referring them to a self-assessment checklist for properly setting up their desk work environment at home. Maintain daily communication with workers, provide continued access to employee assistance programs, and appoint a contact person in the business that workers can talk to about any concerns while they're teleworking. You should also think about how your existing policies and procedures are going to apply when working from home, including notification of accidents, injuries, hazards, and changes in circumstances. Consultation and review of work health safety processes, attendance, timesheets, leave, and other entitlements and arrangements should be given as well. And again, those ergonomics, this is pretty much the same information we had on the previous slides on office ergonomics. We want to give that information to our employees that are working from home so that they adjust their workstations at home. And most importantly, IO Psych. Make sure that your workers are maintaining a routine, or give them advice. Let them know that they should maintain a routine at home. Encourage them not to use extra time to work. So if you're working from home, oftentimes you have that extra time. So you're used to getting up at 7, driving an hour to work. You have an extra hour there where you don't have to drive to work, but you're still getting up at 7. Use that extra hour in the morning to read the newspaper, get some coffee, go out and sit in the garden. It's summertime. That's what I'm doing right now with my extra time throughout the workday. I get my normal 8 hours in, and then I relax. Use video chat so that they get to see people and socialize again. For some folks, being stuck at home is quite, it can be depressing. It can take a psychological toll. So using video chat to combat that helps. As far as maintaining a routine, the reason we do that is because we're creatures of habit. When our routine is suddenly disrupted, we go through emotions such as helplessness, despair, anger, and frustration. So in order to get back into control of that, we have to mimic our previous routine as close as possible. So when I wake up, I get my coffee. When I come over to my office area in my house, it's work time. I try to mimic that. I still try to take lunch at the same time, so I get back into a routine. We want to make sure that we take breaks throughout the day. Okay, and we also want to make sure that we move around quite a bit. We don't want to be sitting around. We don't want to be sedentary. That's going to have bad effects on both our psychology and our physical health. And here is a great checklist from that the federal government put out for their own employees via telework.gov. It's a safety checklist to make sure that things are set up properly. So this link will again be in that PDF that I email out later. Okay, so that is it for the presentation today. I do apologize. I went over by about 6 minutes today. My contact information is here on this slide. I definitely recommend, if you have any questions, that you email me. Also, you can pop into the chat box over on the right side of the video. I didn't have any questions come in today, so if you have any questions, I'll be sticking around here for 2 or 3 more minutes if you want to pop any of that comment box. But then I got to get off here and get reset because I have another presentation to do with the same information but for the state of Washington. So if you have any questions in the future, again, feel free to email me. And do remember, we give free advice. We answer your questions. There's no issue there. But if you want anything like policies written or anything like that, we can give you a quote and let you know what else we can do for you on the consulting side. All right. Everyone have a great weekend and stay safe.